All right, Dr. Ochkus, I've got hair loss question for you. I'm someone who's used 5-alpha reductase inhibitors, finasteride, for years now. They definitely have helped with hair loss, but you always kind of hear like side effects, potential issues long term. I feel like sometimes I've noticed them, but I'm sure, as everyone knows, you read a lot on the internet, that some of it is overblown. But clinically speaking, like, what do you think? What's your opinion on them? Do you think more people have issues that don't, or is a lot of it maybe in guys' heads?
Yeah, so that's something I always kind of wonder, right? Because like post-finasteride syndrome, which is basically the side effects you're listing off, which is libido, brain fog, lack of motivation, fatigue, things like that all kind of fit into this term post-finasteride syndrome. That's not actually a classified syndrome that's recognized by any medical bodies. And so, medicine as a whole doesn't really accept that as a diagnosis. They don't feel like those are legitimate things. However, like working at Merrick, we've seen literally thousands of guys. If you just go onto Reddit, you see thousands of threads of guys experiencing side effects from finasteride, dutasteride, these 5-alpha reductase inhibitors. And so I'm always a little bit on the fence, like, is this real or not? I don't want to tell these people who are experiencing these things that they're not. They're obviously experiencing it, and maybe we just haven't done the studies that have illustrated that. I think that they're probably real, especially when you look at what DHT does. And so I always tell people that a lot of what we get out of testosterone isn't actually testosterone, it's really more DHT. So testosterone can kind of go in a few different paths. It can go into estradiol or estrogen, and it can go into DHT. DHT is what's responsible for that motivation, the aggression, not necessarily the bad aggression, but that drive that we feel with testosterone. It's responsible for strength, for erection quality, for libido. So it does make sense to me that if you're crushing your DHT levels, you're going to feel some symptoms. And so I like to start guys like, if you're on TRT, or even if you're experiencing, androgenic alopecia or male pattern baldness, maybe start more with a topical, because the idea there is that we can blunt the DHT at the level of the scalp and leave the systemic DHT higher, so you're are able to get that strength and erections and all of that kind of thing. That being said, though, there's people like yourself. Obviously, you function amazingly, and you're taking something like finasteride. So I think that everybody's an individual. One thing that I would say is that I do feel like when we take finasteride, a lot of the doses are likely too high. There's some good research showing that even like half of a normal dose was as effective as the dose that we take. And so if you can limit that, I think that would be good.
No, no, absolutely. And I would say, even for myself, anecdotally, I only take a milligram 3 times a week. And that for me has been just effective as when I was taking that same dose every single day. So definitely would have to agree with you on that.
Awesome. So yeah, when it comes to the topical too, there's some confusion there. There's a lot of these companies now that are selling topical finasteride, but finasteride can be absorbed through the skin. It's a small enough molecule to be absorbed. So a lot of times we see guys coming in from these companies that you see all the advertising for, giving topical finasteride, and their DHT levels are still crashed. And at that point, why wouldn't you just be taking a pill? It's so much easier. So I opt for the topical dutasteride, which is a bigger molecule, less of it is absorbed, and then you can again blunt it at the scalp and leave it higher throughout the body so that you can get those benefits. There's also a ton of other emerging products that you can use for your scalp, things like copper peptides, latanoprost. There's other anti-androgens like spironolactone. So you don't have to just be pigeonholed into the 5-alpha reductase inhibitors. So it's definitely something we'll talk about on some other episodes about other options that one could use.
Awesome. Well, cool. Well, yeah, I think that answers my question. I definitely hope that's something they figure out as we move forward. I know a lot of guys, it's something they struggle with. And now, thankfully, one that we talk a lot more about, whereas, 10, 20 years ago, guys just kind of had to deal with it and go bald. So great that we don't have to go that route.